Welcome to Pilar's Pillars, your audio and video access to interviews, communication techniques, insights, and information that will help you speak more and speak better. Now here's your host, Pilar Ortiz.
Welcome, everyone. We decided to record some video series because I had the opportunity to meet in San Antonio, Texas, Rogelio Sáenz. And Rogelio is the Dean of the College of Public Policy at the University of Texas in San Antonio. And it's an expert in the Latino culture, Latino issues. As a matter of fact, he's the co-author with Maria Cristina Morales of the Latinos in the United States, Diversity and Change. So I welcome again, Rogelio. Thank you for your time and thank you for sharing your knowledge with us.
Oh, thank you very much, Pilar.
And what we have been doing is recording mini segments with different topics such as family, religion, immigration, health. We want to be informed. We want to tell others. We want to share information from your point of view. And now we want to talk about health. What do we need to know about the differences and the Latinos and health according to your research?
Yeah, I think one of the most interesting trends that is taking place in the Latino population has to do with health. And here's where you really see a paradox. The paradox is that Latinos, for the most part, are the group, represent the group that is least likely to have healthcare insurance, problems accessing healthcare, and so forth. But at the same time, the Latino population has very low mortality rates and very long life expectancy. So that we can compare, for example, the white population that has a lot more resources, higher levels of education, higher levels of income, lower levels of poverty, and so forth. The Latino population, where you find lower levels of education, lower income, and higher poverty. And what you find is that Latinos actually live longer than the white population. And this has really baffled epidemiologists, people who are studying the health population. There are some hypotheses that have been put forth. One is that you have individuals who immigrate to the United States that they tend to be very healthy. So that to come to the United States, you have to be healthy, particularly if you're coming through undocumented ways and so forth. So that the idea is that people who are the healthiest from Mexico, for example, and other parts of Latin America are the ones that come. So therefore, they do very well here in the United States. Another is that there is something about the culture, something about the diet, something about the lifestyle of immigrants, for example, that results in better health care. So we can think of, for example, the diet that people have that tends to be healthier, more vegetables, for example. If there's going to be tortillas, it's going to be more corn tortillas as opposed to flour tortillas. So therefore, what happens is, and immigrants are also more likely to be moving around to much more active in many respects. So that those tend to translate to better health outcomes. And research suggests that the longer immigrants are in the United States, they tend to lose that advantage because they start eating the flour tortillas, they start eating the pizza, the hamburgers, and things like that. And perhaps starting watching TV, whatever the case, sitting around and so forth.
I was going to say that. I was wondering if we assimilate that part of the culture, the portions are bigger. A small coffee in any country in Latin America, large coffee, it's half of the small coffee in the United States.
Oh, yeah.
The same with soda. So sizes, portions, as we become more.
And sometimes they say, you pay 10 more cents and look at all this more that you get, right?
Right.
And then the other idea is that immigrants, that there is what is called like the salmon effect, that when people get very sick, for example, if they go back to Mexico or to Latin America, and if they pass away there, their death is not recorded in the United States, so that that tends to underestimate the death rates and so forth, because they're counted as a population that is at risk of dying because they were counted in the census, whatever they happen. But when they return to Mexico, their death is not counted here in the United States. And there tends to be some support that it is something that is real, that isn't like some statistical kind of situation. For example, people go, they disappear, and we don't know anything about them. That there tends to be, I think, something with respect to the culture, the diet that is very important, as well to a certain extent that immigrants who come tend to be healthy and so forth.
And Rogelio, some of those Latinos that have high-risk jobs, what about those facts? Do you have some information regarding, depending on what they do for a living?
Yeah, so you have Latinos, particularly immigrants, that are more likely to be working in dangerous occupations. So for one, you find, for example, the deaths, accidental deaths at work. Latinos are always faring worse than other groups because they're a lot more likely to be working in those jobs. But again, the number of people who actually die tend to be relatively small. So in a year, so they're not going to impact greatly the overall mortality rate. And unfortunately, what happens in many of these jobs that are dangerous, it's long course events that are going to take place. So the impact, if you're breathing, for example, chemicals, dangerous chemicals and so forth, it may be that you don't feel, the body doesn't get the impact until 15, 20 years down the road. So then that tends to be delayed and so forth. And one of the things that we find is that even though Latinos live a long life, they are more likely to be living with disabilities, for example, and other healthcare maladies. For example, obesity, the diabetes. These are kinds of illnesses, and that Latinos live for a long time, are living long, but they're living many of those are living with these kinds of health issues.
Mm-hmm. Very interesting. As at everything else, doesn't matter where what our culture is or our ethnicity. We need to take care of ourselves, no matter where we live. But eating well and exercising and taking care of our well-being is going to be very helpful for a long-term living healthy. Thank you. Thank you very much.
Thank you, Pilar.